The average number of daily confirmed coronavirus cases in the country hit a record high over the past 7 days as US officials weighed the impact of more transmissible Omicron variant. These kinds of daily records were broken this week in at least 7 European nations as well. This surge comes as Americans traveled over the holidays. Hundreds of flights have been canceled since then across the country each day since Christmas, as airline staff has tested positive for the coronavirus. Also, experts still don't have enough information on this new Omicron variant. More than 76,000 people are currently hospitalized in the nation. On this and much more, we spoke with Dr. Sandeep Jain. Here is Dr. Jain. You are associated with many clinics across New York City and New York State, and there's a lot of influx of patients that we're hearing about that we're seeing in the hospitals and clinics across the nation. More and more people are getting tested positive. What are you observing right now, and what do you have to say about this rise in case numbers? Are you actually seeing that?
Yes, we are actually seeing the same numbers as being reported by the state. I think in our offices, probably the number is close to 20-25% in some offices. I'm not surprised. If you remember, the Delta virus was 4 times as infectious as the first virus, and this one is 10 times more infectious. There's just no way, if you breathe air, there's just no way not to get it. Face masks, the ones that are N95s, they would work, but the cloth don't, and it's a highly infectious agent. So I'm of the personal opinion that we're all going to get it.
Oh, wow. That's scary a little bit.
The disease is mild. So, New York State, majority of us are triple vaccinated.
Right.
And that's why a lot of people will be saying, oh, I got the vaccine and I still got the disease. Yes, but that's why you're safe, you're protected.
Right. That's so true. And the World Health Organization has actually been warning a lot of countries across the world that a tsunami of infections will arrive with this Delta and Omicron variant mixed together in the next coming months. Are they speaking the truth, you think?
Yes, I believe the numbers are going to be far more than the previous numbers. There's no doubt. However, the hospitalization rate will be very low. It's just that no hospital system is designed to take a certain percentage of the population as an inpatient. We just don't have those many beds. And the biggest worry for me personally is the healthcare workers that were at the front line, they're falling sick. Yeah. And a lot of them have gotten it and they're out of the workforce. Many have chosen not to come back in. So, I think it's for health systems worldwide, this is going to be a bigger challenge in some respects.
Right. And how worried do you think all of us should be right now, especially the ones that are living in the Northeast, about Omicron and the spread that we keep on hearing about?
Yeah, if you've gotten your booster dose, you don't have to worry much. That's my opinion. And it's being borne out by the data as well. Now, if you've had 2 shots and you had the Pfizer, for example, I believe your percentage protection is around 50%. If you have 3 shots, whether it's Pfizer or Moderna, your protection is around 70%. Right. And even if you get it, it'll be a mild infection. So I'm pretty comfortable we'll ride this out.
Yeah, another big news, Doctor, that has come from the CDC is they have changed guidelines for people that are recovering from COVID-19 from 10 days to 5 days if they have mild symptoms. How are you feeling about this, and do you think it's a bit too early for them to do so?
Yeah, I don't think that this is as much science-based as much as it is based on practicality. Not that many of us have enough trust now in either the CDC or the FDA or the government. I think the issue here is, the bigger issue is, it's a mild infection. We can't have so many people come out of the workforce. So everybody staying home doesn't make sense. Who's going to take care of people in nursing homes, for example, or in hospitals? So I believe there's an economic decision here.
Right. Going forward here, I would like to now ask you about the travel situation that we are seeing across the nation. We're seeing high times travel that we have seen. It's the highest since the pandemic. Dr. Fauci, our nation's top health expert, has said that that the government should consider a vaccine mandate for domestic travel, there is a vaccine mandate for international travel already placed in, but there's none of that for the domestic travel right now. Do you think that could happen? And if so, would that be a game changer?
So personally, I'm of the opinion that the government should have minimum powers, and they should mandate the bare minimum. I think when it comes to people's personal choices, it's best left to them. Do I believe that if you have 3 vaccines and you fly, you won't get the Omicron? That's not true. In fact, it is so ineffective. If you take an airplane ride, more likely that the chances are that you'll get it. And yet they didn't mandate it early on. I have no idea why they would mandate vaccinations for boarding domestic flights. I don't think it's going to impact the spread. It's already everywhere. So from a public health perspective, I'm not really sure what it would do. I do feel bad for the airlines and the travel industry in general. However, we have to be very practical at this point in time.
Yeah.
And I personally am against mandates, and I'm personally against forcing people to do something that they don't want to do. I think we're a free country and we're a democracy, and this makes us very vibrant. So as long as people have all the information, people are smart enough to make their own call.
But then what do you have to say about, the mandates that we are seeing in schools, which are actually being very helpful, where the staff is, vaccinated, which is good because some of the students cannot be?
Yeah, so the Omicron variant is still going to infect people with the booster shots as well. So it's not like a foolproof, it's not a foolproof situation where you've gotten 3 shots and you can say, I'm not going to get Omicron.
Right. Continuing this, Doctor, a lot of schools are going to go in person starting next week, but some of the universities are going online starting next week as well. What do you think is a smarter decision?
I think people go to schools and colleges for the social experience. We humans tend to learn from each other as well as from our teachers. I think you're taking away the experience if you don't have it in person. At the same time, I believe people should be flexible. And if some of the class wants to be at home, that's fine too, because people have medical conditions or have family members who are dealing with cancers and they don't want to be infected. So I guess there's each school will find its own perfect method to do this. Again, it should be left up to the schools and up to the students.
Yeah.
If I was a student and I went to a university, of course, I would want to be in person myself.